Ovadia, right? Okay. I'll get it right. Hi there, and welcome to another success story and a personal journey we'll be looking into, and a professional life as well in health. I've got the heart surgeon, Dr. Philip Ovadia, with me. So, hi, Philip.
How are you doing, Stephen? Good to see you again.
Great to see you. Obviously, we talk about your book, but everybody that's seen the channel knows I tend to always start with a personal question. And your Twitter feed, it starts with this. It says, in my profession, I was a complete success, and in my health, I was a complete failure. So I just really want to touch on that first. About 2014 is the picture I've got of you. Unrecognizable. Seriously. If you'd have sent me that picture when I first met you at MeetRx and said, who is this? I genuinely would not have thought it was you. So can we just talk about that part of your life first before we get into the book and some nitty gritty?
Yeah, sure thing. You know, I found myself, and this is, more common than it should be, because we think doctors are here to improve our health, and therefore we should be able to take care of ourselves. But unfortunately, what I see way too often in the medical profession is that doctors, nurses, other healthcare practitioners are just as prone, and maybe even more so, to poor health than the general public. My personal story goes back to my childhood. I was obese for as long as I can remember. And that was despite the fact that I was doing what people generally believe you need to do to be healthy. I grew up in a household that ate according to the U.S. guidelines, the U.S. dietary guidelines. I have an older brother who is a type 1 diabetic, so we didn't have sugar in the house. We ate all of the low-fat stuff. We had the margarine instead of the butter, and we had the skim milk on what were supposed to be our, heart-healthy whole grain cereals every morning. And I was also very active my entire childhood. I played sports. I was always riding my bike and walking places. And so, by all rights, I shouldn't have been obese, but I was. And this got worse as I went through my schooling. And then, getting into the difficult training that it takes to become a surgeon, to become a heart surgeon, it only got worse. And, I tried a number of times to get healthier, to lose weight. I did what I had learned to do. I counted my calories, I ate less, I moved more, and I would have some short-term success, but ultimately, like so many people, I would gain back the weight and more. And so I found myself at a crossroads. This is going back now about 7, 8 years ago, where I recognized that I was going to end up on my own operating table, so to speak. I was following the path that so many of my patients had followed. I had the family history. My grandmother, had heart disease, had multiple operations, ultimately died of heart disease. So I knew I was heading down a bad path, but I didn't really know what to do about it, to be honest, because everything I had learned had failed me. Thankfully, at that point, I started to come across some different information, some different ideas. I was very fortunate to be at a medical conference where Gary Taubes was the guest lecturer. And, he had just written The Case Against Sugar. And of course, prior to that had written, Why We Get Fat and Good Calories, Bad Calories. And he was really the first that I heard, the types of food that you eat are more important than the amount of food that you eat, essentially. And it made a lot of sense. I read his books. I went low carb. I had great success. And then I started asking the questions as to why didn't I learn about this in school? Why did I hear about this from a journalist? And that's by no means any sort of knock on Gary. It just, why wasn't this what I was taught in medical school? And why isn't this what our colleagues, my colleagues were talking about? And, that led me to a number of different information sources and down a number of different pathways. But ultimately, here we are, 7, 8 years later. I have now lost over 100 pounds. I've been able to maintain that weight loss. I have come to recognize that this is the way to prevent the vast majority of what I do in my career, taking care of heart disease, and that we need to get this information out to the people who are struggling with metabolic health, heart disease, and all of these chronic diseases that are plaguing our society today.
What was your first steps then? What did you do? Did you cut out particular things? What was your actual practical development once you heard that information?
Yeah, so for me, it really started with cutting out sugar, and then, cutting back on carbohydrates. And then as I learned more, it evolved. And ultimately, I ended up with a mostly carnivore approach. And that's the approach that I've now stuck with for the past 4 years. The real reason that I ended up with carnivore and sticking with carnivore, honestly, is because I just find it the simplest to do. And I think it is most evolutionarily consistent for us as human beings. I don't think it's the only way to do it. I don't tell all my patients they need to go carnivore. My main sort of, way of thinking around what we eat is that we need to eat real food first and foremost. If we just get to eating whole real food and we eliminate the processed food, that's going to get most people most of the way towards the improvements that they are seeking.
Yeah. That's strange, because that's exactly what I said to a coaching client this afternoon. Once you cut out the seed oils and sugars and anything in a box that's processed, you're really on your way by a big percentage. But I'm going to be honest here. I mean, this is, I met you 4 years ago, and in the last 4 years, you've definitely changed. You look younger than when I first met you, even 4 years ago. So I think carnivore, for me, seems to be like the butter on the steak. It seems to just push you a little bit further, but many people might be quite happy in keto or low carb land, because you do definitely make some big strides there. So you mentioned in your first bit about your operating table, which nicely brings me on to your book, which is entitled Stay Off My Operating Table. And in it, you have 7 key principles of metabolic health. And the one that really resonated with me, we'll go through all of the points if you don't mind, but the one that really resonated with me was mindset, actually, because there was I asking you practical things, what did you do, what did you eat? But I think mindset is underestimated. So why did you focus on that?
Yeah, so as you said, I put that first. I do believe it needs to be the first principle, because if you're not intentional about what you're doing and you're not thinking about what you're doing in the right way, it's ultimately not going to succeed. And the way that I describe it, the principle that I lay out is you need to think of your health as a system, not as a goal. The mistake that I think too many of us make, and quite honestly, the healthcare, system often makes, is that we're focused on short-term goals around our health. People say that they want to lose 20 pounds. And one of two things happens when you set a short-term goal like that. You make changes and you achieve your goal. And then you tend to say, great, I did what I set out to do. And you end up going back to what you were doing in the first place that got you into the problem. The other scenario is that you don't meet your goal. It's hard to lose 20 pounds. And you get frustrated and you end up quitting and you end up going back to what you were doing beforehand. So I think, either way, it's a faulty way to think. Instead, you need to think of your health as a system, and you want to be optimizing that system. And you want to find the positive habits that are going to allow you to get to optimal health. So when you tell yourself, I want to be metabolically healthy, and these are the things I need to do to be metabolically healthy, it's a more sustainable way to think. It's a more positive way to think. And I think ultimately it is what's going to lead you to success, rather than just focusing on those short-term goals and changing, habits in the short term.
And so what do you mean by metabolic health, just for the people watching?
Yeah, so simplest way I explain it to people is metabolic health means that your body, when you are in good metabolic health, your body is properly utilizing the inputs that you are giving it. And the primary input we give our bodies is the food that we eat. And so it's properly, partitioning that food into the proper purposes. And the main, the purposes of our food, first and foremost, is to provide immediate energy to fuel all of our activities. We use some of the fuel, we break it down, and we build and rebuild our tissues, a process that's always going on. And then we're supposed to store some of that energy for times when food isn't readily available. And for most of our existence as human beings, it was challenging to get enough food. In modern times, we now have the opposite problem, that there's essentially too much food around us. There's always food around us. And so we never give our bodies the chance to use the stored energy that we have. And that's where we start to get into these chronic problems that then result from poor metabolic health, where we're no longer properly, partitioning, we're no longer properly using the inputs that we are giving our bodies.
Now, I'm going to throw you a curveball, because I'm asked question a lot, because I pretty much believe everything you've just said, and I say it in very similar ways. Then I will have someone challenge me and say, well, you're saying that we're storing all this energy, but you constantly tell me not to undereat and to eat enough, which is also one of your principles. So how do you get that across to people after saying, we're storing too much food?
Yeah, so the key is eating enough of the right food, of the right inputs, because, when you give your body the right food, your body is then going to give you the feedback that it's enough. The problem is that most of us have spent our entire lives eating the wrong foods, eating these processed foods. And the processed foods hijack those signals. Our bodies can't tell when we're hungry or not anymore, essentially. There's a physical addiction that comes with lots of the components of these processed foods. And there's also the issue that we're not giving our bodies the nutrients that we need. Understand that our bodies do not sense calories. They do not sense amount of food. They sense nutrients and the nutrient, components of that food. So you can be eating a whole lot of food, but if it doesn't have the proper nutrients that your body is seeking, that's when your body just constantly says, I'm hungry, I'm hungry, I'm hungry. When you're eating foods that are ancestrally consistent and nutrient dense, your body's going to tell you when to stop, and you're not going to be hungry all the time. And that really is what ultimately leads to success when we're eating whole real foods, is that we can regain those proper signals, and our bodies can now tell us, we've had enough, we don't need any more, you're not hungry anymore. And when you're not hungry, it's easy to lose weight. The problem is we've always approached weight loss in a way that makes us more hungry, and therefore it becomes very hard, if not impossible, to do.
The next thing I want to ask you about, I mean, that's a perfect answer for me as well. I like that. Is one of your principles is getting less stress in your life. So can you expand on what you mean by that, and practical tips to reduce stress?
Sure thing. And stress is a big factor when it comes to our metabolic health these days. The effects of being overstressed on the body directly lead to metabolic health problems in a number of ways. And some of the ways that this, becomes obvious, some of the ways that this manifests is, first of all, when we're more stressed, we tend to get hungry. When we're more stressed, the hormonal environment in our body is shifted towards again, storage, too much storage and not being able to use those stored nutrients properly, that stored energy properly. And quite frankly, the other effect of stress is just that it distracts us so that we're not thinking about what we're doing anymore. We're not being intentional about what we're eating. And everyone has had the experience where you're stressed out and you're just grabbing whatever is convenient around you. And again, in our modern environment, that tends to be processed food. So those are the reasons that stress has a negative impact on our metabolic health. Now, I'm realistic with people. I know that we live in a stressful world and that, we can't necessarily eliminate the stress. We just have to find a way to process and deal with the stress better. And this is going to take, different forms for different people. For some people, these are things like meditating. For other people, it's being part of a strong community, having family and friends around you. For some people, exercise, becomes a way to offload their stress and to deal with their stress. And as long as you have a way that the stress isn't just always building inside of you, that should, you'll be okay. But you got to figure out, what that is for you and what you can do so that the stress doesn't become a negative factor in your life.
Well, I would imagine you're an expert at this, because I can't think of a more stressful situation than opening up a patient and operating on someone's heart, knowing that there's a bunch of family waiting outside. So I'm going to turn this around again and just ask, how do you manage your stress? Or do you find the job isn't stressful because it's so rewarding?
Yeah, I do think that the rewarding aspects of it outweigh the stressful aspects. But I will also say that, since becoming metabolically healthy, since, being carnivore and low carb before that and losing all the weight and getting my metabolic health in order and eliminating processed food, most importantly, I deal with the stress a lot better today than I did, 10 years ago. And I think that's part of the benefits of getting metabolically healthy that sometimes isn't fully recognized. It just seems that your moods are more stabilized, when you're not having your blood sugar levels going up and down constantly, and your brain is utilizing more ketones for energy than sugar. You can just have a more stable approach to all of this. But for me, my main way of dealing with stress is my community. And that starts with my family and my friends, but that also extends to the community of the patients that I serve, and, the metabolic health community that I serve. Those are all ways for me to offload stress by helping others. So like I said, this is going to look different for everyone. You just have to figure out what's going to work for you.
So one of the offshoots of stress is fasting. Some people don't like fasting because they feel that's too stressful for them. Do you have any particular views on fasting?
Yeah, I think fasting can be a great tool if you're looking to improve your metabolic health. I think it does need to be done correctly. And my main rule around fasting is it shouldn't be something that you have to force. If you're, trying to fast and you're constantly hungry and you're just sort of, what I call white knuckling it and hanging on until the end of, whatever time you decided your fast should end, I don't think that ends up being a positive habit. But if you're fasting because you're just not hungry, then I think it's a great tool, and it can add to the metabolic health improvements. So ultimately, I try and get people to a place where they're hungry less often, and therefore they can utilize fasting as another strategy that's going to be improving their metabolic health.
I think it's fascinating, and I'm really enjoying speaking to a heart surgeon, because I've got a couple of questions that always comes up when people have heart problems, mainly down to possibly misconceptions. So I'm going to fire one at you. So how does the heart run? Does it run on glucose? Does it run on ketones? Does it like fat? Does it hate fat? How does the heart react to fat?
Yeah, so the heart is going to run on whatever's available. I mean, obviously, in terms of staying alive, the heart is the priority for the body. The heart and the brain, especially, are the two are the two organs that we can't live without. So they're going to use whatever's available. The evidence seems to suggest that ketones are the preferred fuel source for the heart. And the lines of evidence for that are, come from a number of different ways. But ultimately, ketones do seem to be the preferred energy source for the heart. And I think it's the more reliable energy source for the heart. We know that, ketones are a kind of steadier burning, a steadier energy source than sugar, which is always going sort of up and down when we're dependent on it. So I do believe that ketogenic metabolism is preferable for the heart. We do have some evidence now showing that, for instance, people in heart failure, that they can benefit from ketogenic metabolism. And so, and that you can't separate ketogenic metabolisms from fat ultimately,
Yes.
So I don't believe that the heart reacts negatively to fat. I think that fat, and whether that's your body fat or fat that you're eating to promote a ketogenic metabolism, is going to be beneficial to the heart.
And the final question in this, sort of putting you in the spotlight, but you're a heart surgeon, so people would want me to ask this, is can you give your view on LDL cholesterol?
Yeah, so I think that the first answer I give people to the LDL cholesterol question is that LDL cholesterol by itself is an inadequate marker of heart disease risk. It's a lousy marker of risk. And I see this in both directions every day. There are many patients that I operate on who have what are considered normal or low LDL cholesterol levels. There are many people I work with every day with very high LDL cholesterol levels, by the traditional metrics, and they have no evidence of heart disease. So this tells me that LDL is giving us an incomplete picture, and I really think it's not a useful metric. We need to go beyond LDL cholesterol if we want to figure out if someone is at risk of heart disease or not. And this takes a number of different forms. This is the advanced lipid testing, looking at lipid particle sizes. There are many other metrics that are much more useful to look at than LDL cholesterol. So ultimately, does LDL cholesterol matter? In some people, yes, it matters. In many people, it doesn't matter. And if you are metabolically healthy, the totality of the evidence is that LDL cholesterol is not something to be concerned about. But I still want to know beyond your LDL cholesterol level ultimately. And I think it's important to be looking at advanced metrics. I think it's important to be working with practitioners that understand those advanced metrics so that they can truly help you understand whether or not you're at risk of heart disease.
So when you get the first consultation with a patient, has it already been decided that there's nothing that person can do and the only option is surgery, or how does it work? What's the process?
Well, so in my heart surgery practice, understand that I have two separate sort of medical practices. I have my heart surgery practice, and then I have my preventative health practice. But in my heart surgery practice, by the time patients are sent to see me, usually, yes, their other doctors have decided that surgery is imminently necessary. or is going to be the right option for them. Now, sometimes that ends up being the case, and other times it doesn't, due to a number of different reasons. But, my role as a heart surgeon is to figure out, is heart surgery actually the right thing for you? What's really evolved in my practice as a heart surgeon, though, is I now fully recognize, and I have the discussion with the patient, that me doing the surgery isn't going to change what led to that person needing the surgery. And this is, again, where the diet and the lifestyle comes into play. Because I can do the heart surgery, I can improve, the problem. We can get more blood flow going to the heart where it needs to be, which is typically the problem that we're dealing with. But we still need to address what led to you needing the heart surgery in the first place. Or again, in the long term, you're not going to get the good results. You're going to have more problems with your heart. We know this is the natural history, that many, many patients after undergoing open heart, bypass surgery end up needing more stuff done down the line because they continue to have issues with heart disease.
And is that because of diet, is it?
Yeah, exactly. It's because the surgery hasn't addressed the underlying root cause of their heart disease. And typically that is diet and lifestyle related. So we need to address those things as well as doing the surgery.
Because you're looking at the patient holistically. Is that something new in heart surgery, or is that something that's always happened?
Well, that's something new for me in heart surgery. I can certainly say, 10 years ago, I would just do the surgery and then, and this is the general way that the medical system functions, is you do the surgery, you view the problem as taken care of, and you don't address the underlying causes. And like I said, the natural history is that it's then going to become a problem again in the future. So this is certainly, the approach that I now take is very different than the approach I used to take, and very different than the approach that the medical system still largely takes, which is, the surgery will fix the problem and you don't really have to worry about what caused it in the first place.
Which is so short-sighted and so obviously not working out well, is it really? I had a coronary artery calcium scan before I went low carb, and it was 639. Do you think there are any benefits in obtaining a CAC scan?
Yes, I think the coronary artery calcium scan is one of the most useful and one of the most underutilized tests available to us in medicine, and specifically when it comes to heart health. Because once if you identify the issue, you can then take steps to stop that from progression. And we can identify it early enough that, it's not going to have long-term negative consequences on your health. So I am a big advocate for coronary artery calcium scans. And when we get them, and when people like yourself have scores that are high, but not to the level that they're dangerously high and that they're, putting you at imminent risk of a heart attack, the mission then becomes stop that from getting any worse. And the way to stop it from getting worse is to, again, address those diet and lifestyle issues that led to the problems in the first place. And when you change those, I have now seen many, many patients who have been able to stop the progression of their coronary artery calcium, stop the progression of their heart disease, and that should get them to a point where they won't ever get to the point where they're going to be coming to see me as a heart surgeon now.
So what would be a level where you said you need critical intervention? So, 639, I was told at the time, which is 5 years ago, I'm still alive, so they were wrong. The consultant I had didn't sugarcoat it. He said, well, wow, if you live 5 years, you'll be lucky, which I think is completely terrible bedside manner, but we'll not mention that. So what sort of levels would make you think, well, we've got to move on and get that person on the table.
Yeah, well, so, I never operate just based on a coronary artery calcium scan. There's always further testing that if we're very concerned. And, it's hard to put an absolute kind of cutoff on that. It's going to vary some because there's different distributions of calcium and such. But, generally when it starts getting up, around 1,000, you need to be concerned, and typically I'm going to recommend further testing to see if you do indeed have a significant blockage or not in your heart. I've seen patients get up into the, I've seen scores as high as 6,000. Now, patients with scores that high almost certainly have significant disease. But I have seen patients, around 1,000 that turn out not to have significant disease, meaning that they have a blockage that's significantly decreasing blood flow to an area of their heart, but it's still a concern. And then, like I said, the goal becomes stop the progression. Don't let it get worse. And this is another place where I think we fail, with the coronary artery calcium scan. I don't view it as a one-time test. A patient like yourself, in my practice, we would be repeating that scan. We want to know, is it going up or not? Because again, we know that the absolute number is one predictor of risk, but we also know that how that number changes over time is perhaps even a more powerful predictor of risk. And if you have a 600 today and you make changes, and 2 or 3 years down the line, it's still 600, that actually puts you into a lower risk category because it's not progressing over time. So, there's lots of important information that we can get from the coronary artery calcium scan. And again, this is why it's so essential to be working with a practitioner who understands these nuances and can help you, to decipher it for yourself.
Yeah, I think that's one of the other principles, isn't it, in your book, where you talk about getting a partner or a coach or a doctor on board with you as a critical thing. Yeah,
exactly. I think one of the other key principles here is finding a doctor or another practitioner who understands this and can help you to work through these very complex issues. Ultimately, we have to understand that heart disease is a very complex issue. It's not as simple as one number on your lab testing. And so you need to be working with physicians who understand this. And metabolic health is a complex issue. And it's not as simple as telling everyone, this is what you should eat. There are lots of factors that go into metabolic health, and there are lots of nuances that are going to vary from person to person. And that's why it's important to be working with a good practitioner, a physician, a coach, whatever it might be, who understands this and can help you work through it.
Thank you, Philip. That's great. I mean, I think I'll put you under the spotlight of it. You don't mind that, do you? Because I think people
not at all
don't get access to heart surgeons every day. One of the most common things that I encounter with people that transition is they worry about heart palpitations. And some people seem to get heart palpitations, which they seem to fix a lot with just electrolytes. Would you be able to give it a very broad view of why that might be happening to some people? Why would they be getting AFib?
Yeah. So first thing we need to do is help people to understand that, AFib, atrial fibrillation, and heart palpitations are not necessarily the same thing. You can get palpitations from atrial fibrillation, but there are also lots of other things that are not atrial fibrillation that can cause palpitations. And it's rare that I experience people who develop atrial fibrillation from the, when they're transitioning to a low carbohydrate diet. Palpitations, do tend to be a little bit more common. And like you said, it's typically related to electrolytes. When our body is basically shifting from a carbohydrate sugar-based metabolism to a fat ketone-based metabolism, there are lots of hormonal shifts that occur. There are lots of shifts that are going on within the body that can cause electrolyte imbalances. And so I do agree, it's very important to be paying attention to your electrolytes as you're making that transition from a carbohydrate-based diet to a low-carb diet.
Brilliant. So I think there's a few things. I don't want to push you too hard, but one thing I'd be very interested in is your colleagues that don't believe in low carb. I mean,
Yep.
Do you find it frustrating, especially as you're a very good example? Your old pictures pretty much show that you've turned your health around 180 degrees. How do you cope with colleagues that are quite resistant to sort of any change?
Yeah, so I understand because I obviously didn't know about this before I learned about it, and it is not something we get educated on in school. So I understand that they may not, that they don't understand it, that they're not comfortable with it. But I can't give them a pass because ultimately, if there is something that could potentially help you and your patients, and you're not at least willing to consider it, I think that is not being a good physician. We owe it to our patients, we owe it to ourselves and to our patients to do whatever we can to take good care of them. And unfortunately, many physicians are trapped within the system, and the medical system is so focused on taking care of sick people. Quite frankly, these days, the medical system in many places is overwhelmed taking care of sick people. And so that physicians don't have the time, don't have the energy to kind of step back and ask, how can we keep people from being sick in the first place? It's a very difficult situation for physicians. There are lots of things that, there are lots of reasons that they are, may not be allowed to kind of consider these options. They simply don't have the time in many scenarios. Here in the US, the average doctor visit is, I think, around 12 minutes, and that's not enough time to explore these issues with patients. So there are many systemic things that work against it, but ultimately, my role as a physician, my calling is to do whatever I can to help patients. And so, when I discovered this and when I saw it, first help myself and then start to help patients and help others around me, I considered it my duty to get this information to as many people as possible. And that's what has led me to do, everything that I'm doing today, whether it's writing the book or having the preventative medical practice, doing all of these appearances and the podcasting and all of those things that go into it. It is because, I am on a mission to get this information to as many people as possible that can benefit from it.
Yeah, and your book is amazing. I love it, and I love the fact that there's some really simple sort of practical steps you can take, and I like going through the 7 steps and all those sort of things, which I really like. I suppose we can't talk to a heart surgeon and not mention the dreaded saturated fat. So I wonder if you have any views on that, because I'm still finding people are scared of fat, very worried about fat. I think, to me, there seems to be a growing body of evidence that is a misconception. And also, I would say the low-fat diet craze for the last 50 years hasn't turned out a pretty good experiment, really. So I wonder what your views were on saturated fat.
Yeah, so exactly. This is one of the biggest places that I think our healthcare system, has failed. because the evidence at this point is quite clear that saturated fat, dietary saturated fat, is not what is driving the heart disease epidemic. It is not what is driving our metabolic health epidemic. And like you said, the efforts that we have made to lower saturated fat in the diet have only worsened our overall health. We need to acknowledge that we evolved as human beings eating saturated fat. And so it's really was, foolhardy to go down this line of reasoning in the first place, but we now have all the evidence that we need that it was a mistake. And honestly, that's what our medical system needs to do. That's what our public health officials need to do. The dietary guidelines need to do is they need to stand up and say, we made a mistake. It wasn't saturated fat that was causing the problem. There's no reason to fear saturated fat in the diet. And, that would go a long way towards improving our situation. But since we can't do that, since they won't do that, the institutions won't do that, it really becomes, more of a, again, that personal mission, the grassroots effort to spread this word. Because we also need to acknowledge that, many of these institutions have quietly removed their recommendations around saturated fat. They just didn't make that big announcement. And so, again, many practitioners, many doctors are not aware that the limitations on saturated fat are actually no longer in the recommendations. But, if we don't publicize that, then people aren't going to get that information. And again, all of this other stuff that we did because we thought saturated fat was the problem, and trying to create a food supply that didn't have saturated fat in it, or it had much lower levels of saturated fat, has only worsened our health. And we need to reverse course on that.
Yeah, definitely. I'm a big follower of yours. So I seem to remember, I don't know if it was on a podcast or in the book, where you briefly touched on the fact that people that are arriving at your operating table are actually seem to be younger now since you started. Could you just expand on that? I'm sure that was something you mentioned.
Yeah, certainly. And this is one of the most concerning and really most obvious trends that I have seen in my career. When I started as a heart surgeon 20 years ago, it was exceedingly rare that we would be operating on patients under 60 years old. And today, just 20 years later, it is now common that I operate on people in their 40s. And even every once in a while, I'll operate someone in their 30s. So very concerning trend, because again, we're not talking about, 100 or 200 years there. We're talking about 20 years that I have been a heart surgeon, and this trend is quite noticeable. So it just, again, goes to speak about how badly we are doing in terms of our overall health, how much of an epidemic the metabolic health problem has become. And if we don't do something to reverse that, if we don't do something to change course on that, it's really, it's literally bankrupting our societies. It's bankrupting our countries, trying to pay for this medical care. And more so, when you have people who are getting devastating health problems and, can no longer be productive members of society that young, ultimately that leads to, very big problems that we're going to have to deal with.
A frightening trend. And going back to your colleagues, I mean, they're obviously seeing that as well. So you would imagine, well, hopefully that's going to start making them consider what you're saying possibly has a bit more validity than maybe they thought in the past. I think you've done brilliantly. I've really appreciated it. I'm going to ask a very broad question because I did focus on the heart, because what's the chances of everybody speaking to a heart surgeon for this amount of time? So I was trying to ask the questions that everyone would want to ask you, I think. But I'll just be a bit more general, because you talk about metabolic health, and I love that you do that, because a lot of heart surgeons might just concentrate on the heart, and it sort of dissolves the message, really, because the animal-based diet seems to improve so many things. I mean, I'm lucky. I've been doing this, as you know, with carnivore coaching for about 4 years, and I've got over 500 clients now, and I've seen so many things resolve. So how would you explain animal-based diet helping so many things? What do you think is happening in the body to be able to resolve so many different issues?
Well, I think, again, this modern concept, this very recent concept that, somehow all of the, different organ systems within our bodies are like disconnected, really, again, doesn't make any sense. It would be hard to imagine a scenario where our bodies evolved in such a way that things that are good for one system are going to be bad for another. All of our organ systems are within our bodies, and they all need to work together. So it just makes sense that what makes one better is going to make another one better. And again, I go back to the big picture. It is much more likely that the types of foods that we have been eating for millions of years are going to optimally support our health than some foods that were created, in the past 100, 150 years, or only became common within the past, couple of thousand years. If you're talking about, agriculture in general, it is much more likely that the foods that we've been eating for millions of years as human beings are going to be what we run optimally on.
So, Philip, thank you so much. I just want to thank you for giving your time. I know it's really valuable. You're obviously really busy, so I really do appreciate it. Thanks for coming on.
It was great talking to you, Stephen.
So if you were doing your blood glucose, you will think, wow, I am really healthy. This is great. My blood glucose is being managed. But what that graph is also showing you is the background insulin going up and up and up. What was happening is the bodies for those people in that particular study, they were requiring more and more insulin to get the same result. And at some point, as you can see from the graph, there's a tipping point where there's so much insulin being produced, it just can't keep doing it. The pancreas just can't keep up. And that's when it starts to dip in production. That's when the blood glucose goes up. Maybe 10, 15 years previously, if we were measuring blood glucose and insulin, we would have predicted a problem, but we weren't doing that. And even now, most people just measure their blood glucose. They don't see the problem.